is there ever the possibility after progression on alectinib, progression on lorlatinib, to return to alectinib if ALK is presumed to still be the driver?
Ooh,
Would you like to
this is a
comment on that?
yeah, this is tough. I really cannot think of any scenario where the sequence is reasonable. But I mean, certainly there's role of going back to crizotinib, and even after lorlatinib, and Dr. Shah, I believe, described it in NEJM a couple of years ago, in a very specific scenario where there's a certain ALK-resistant mutations, you can really go back to crizotinib that can overcome that specific mutation. But if the patient has already progressed on alectinib, I'm not sure whether going back to alectinib makes sense, after progression on lorlatinib. But there may be a case scenario, but I really cannot think of any right now.
Yeah, I agree. I would say unless there is a very rare situation where lorlatinib-resistant tumor is genotyped and a double ALK mutation is found that's known to be sensitive to alectinib based on studies. That would be the only situation, but that would be, I would imagine, very rare situation. In most instances, we would not think of returning to alectinib after disease progression of lorlatinib. Now, let's say somebody has had extracranial, so body progression on lorlatinib, but the brain was continuing to be well controlled. However, lorlatinib was very hard to tolerate for the patient, where side effects were a major issue. So they were moving on to another therapy, like, for example, chemotherapy, but the oncologist was hoping to continue some sort of CNS active ALK inhibitor with the chemo. To that end, that would be an instance where going to alectinib could make sense.